how can you use and capitalize your ethnic and cultural diversity in what you do as a doctor? And how can you use these concepts of integrative health, which focuses on individualized or personalized healthcare, using conventional, complementary, and self-care techniques to help you be more prepared in these times. So I'll tell you a brief story and let you know how to find out more about this at the end. So many years ago, when I first qualified as a GP, I suddenly realized all my years of training really didn't prepare me for what I would see. I didn't realize that 20 to 25% of all I would see would be musculoskeletal problems, soft tissue mainly, that mild to moderate mood disorders would account for a whole lot of what I saw, and there was a shed load of medically unexplained symptoms. So I thought to myself that there's something more, there's something missing, and that something maybe lay in how and where I had come from and my childhood. As always, it's not until you make your mistakes, and maybe it's not just one mistake, but another and another and another, until one finally hits home and it makes you change. So I made my mistakes, and I blamed the fact that I was foreign and I grew up in a different country and I have a different ethnicity and cultural background, and that I was different until I decided to do something about it. I looked into my communication skills and I improved them by studying neuro-linguistic programming, NLP, having not gotten well with studying CBT at that time. And I improved my musculoskeletal skills by going on an acupuncture course with the British Medical Acupuncture Society, which are Western doctors practicing medical acupuncture. Acupuncture really just opened my eyes as to what was possible. People in pain for years and years, just short of having surgery, would get better. They'd stop their pregabalin, their tramadol, their morphine, their anti-inflammatories after having as little as one session of acupuncture. It was almost unbelievable. So sure, it didn't work for everyone, but it worked more often than I thought it would. And it was safe, and it didn't involve drugs. In fact, it was the first time I was taking people off drugs. Back then, it was the thing to start people on the WHO analgesic ladder. I didn't ask questions back then about coming down the ladder. And now we have this opiate epidemic. So the years have gone by and my skills continue to improve, and I offer acupuncture to help my patients on the NHS who prefer alternatives to conventional drugs. And when I think it's the best treatment for them, I offer it to them. I think medicine is about offering the right treatment for the right person, for the right condition. Individualized or personalized healthcare. So NLP, I know you're all interested in that, was a little slower, because the real magic of NLP and personal development lies in changing yourself. Despite almost instantly seeing a drastic fall in complaints, improved patient satisfaction, I was still missing something. I didn't realize that until I had a health issue. This is when I tell you my sob story. So I woke up one day with a Bell's palsy, really dense Bell's palsy. Now you'll see it, because I've mentioned it. It didn't improve. It was really dense. Most people, of course, do get better, but mine didn't, and I got depressed, I got upset. Then I was offered a place on this NLP course that was an advanced course which involved hypnosis, because I thought it would help my depression. Because sure as hell, I wasn't going to see a doctor for it. Back then, that's not me. That's what I thought. I'm sure a lot of you will know that feeling. So I took this up, and suddenly, when I was on this course, under hypnosis, in front of everyone else, I realized this concept that if you're deeply relaxed, your body can do miraculous things. I realized I was stressed all along, and that volunteering for the weekend and evening shifts while working full-time and looking after a young child, as is so often the case of what we do, somehow having to prove myself. And I think this is something our community, the BAME community, are guilty of. Doing too much, trying to prove ourselves. I realized this. I realized that back then, when you are physically unwell, that it could make you feel mentally unwell. But I didn't realize up to that point that if you were mentally unwell, that you were stressed, if you were upset, if you were washed out, that this could affect your physical health. Because when I was deeply relaxed, the Bell's palsy improved and my face started to move. It was the first time in 5 months, and it continued to improve afterwards. It's not completely normal, but sure as hell better than a dense paralysis. That was the moment I realized I had to rethink my life, rethink my background and my prejudices and my preconceptions that led me to the concept of integrative health. It opened my eyes to the growing concepts of psychoneuroimmunology, neuroplasticity, the microbiome, meditation, and the capacity for the body's self-healing properties. That so much of traditional cultural healing techniques have focused on. Techniques such as Ayurveda from India, traditional Chinese medicine being the two most well-known ones. These healing methods might actually have more to them than the less than 100 years of conventional Western medicine, since the development of antibiotics, that is. Sure, you need antibiotics. Sure, you need scans. You need tests. You need surgery. You need chemo, radiotherapy. But you also need to set the environment right for long-term health, staying healthy, being active, eating right. So I started to ask questions. Could all this pseudoscience stuff from my childhood, growing up in a different country, or different culture, belonging to a different ethnicity and way of thinking, be actually beneficial? Are there actually other ways of setting up the right conditions to encourage healing, to encourage health? I made friends with people interested in the same thing, and we started the Integrative Health Convention, allowing doctors, complementary therapists to look into how complementary and alternative medicine and other therapies can help working in conjunction with conventional medicine. We had the largest conference in the UK where both complementary therapists and doctors come together. What we found is that health is not black and white. It's like the world. It's shades of grey. It's a continuum. Sometimes some treatments work better than other treatments. And it very much depends on a person's innate ability to heal. I think healthcare is also about the least invasive and the least harmful treatments we have to encourage the right conditions for us to improve. Of course, if we have the most effective treatments, that's going to make it even more effective. So the story continues because we were recruited then by the College of Medicine and Integrated Health, who we run our events with, who have royal patronage from His Royal Highness the Prince of Wales, where they've also been fighting for different views in health and healing. They ask the difficult questions. Are there other ways of doing things? Is healthcare really accessible? Is medical education addressing the needs and wants of the people? In fact, they helped initiate and push through this concept of social prescribing, which is part of personalized care. Personalized care, if you don't know it, is something that the new GP contract is focusing on. And social prescribers and health coaches that PCNs are now funded to hire are part of this move for personalized care. In fact, my practice is interviewing next month for our health coach. Now, having experienced a miracle on myself and having asked all these questions, I've changed my life. I take priority in looking after my physical and mental health. I manage stress. I meditate every day. I eat healthily. I fast 2 or 3 times a week. I learn and I ask questions. Is there more to this problem? Is this the right way of doing things? Can I do things better? Is there something in my background, from my personal experience, that I can use and explore? I also ask my patients to attempt to do the same. And perhaps you will too. So I ask you today to look into what your childhood, your personal experiences, your unique views, granted to you by your cultural and racial backgrounds, and ask these questions to yourself. And I ask you to consider being kinder to yourself, to look after yourself. And I hope you never have to learn the hard way by having a health problem. So I think the RCGP, it's on the right path, supporting personalized care, working with the individual to see what's important to them and for them, where we can help guide them through their problems as true advocates, I do think, though, we need more training in integration, on asking questions, on managing stress and self-care techniques, up-to-date guidance on diet and exercise, and better coaching and motivation skills. So I invite all of you to find out more. You can look up the College of Medicine, the Integrative Health Convention. You look up my name on the internet, you might find out a bit more about us. Thank you.